all families. In December, I was surprised by the words from a member of Kelowna Mission. I quote, "We need more healthcare professionals that can advocate for patients and deliver the absolute best care possible, not just more nurses," end quote. Member also mentioned, I quote, "I don't want an MRI. I don't want or need a new MRI," end quote. I would respectfully like to share my thoughts as I come from healthcare background. I hope the member understand that nurses focus so much on preventative care. Nurses are the biggest advocates for their patients, and in fact, it's one of their nursing standards that they must meet. Furthermore, nurses are trained to look at the patient as a whole. For example, when myself or my colleagues go to do wound care, we look at patients' diet, underlying medical conditions, living arrangements, their mental and physical well-being, and whether they need more supports. Nurses always provide emotional support to patients and their families, even when patients pass away. Community nurses make condolence calls and even send cards to the families, connect them with grief counseling, and many other resources as needed. Nurses work with patients from birth to the end of their life and anything in between. Nurses work in nursing homes, community outreach clinics, harm reduction centers, mental health, and telehealth, and so much more. They work in public health, taking care of newborns, teaching parents how to take care of newborn and toddlers. Nurses do outreach work in schools, and this is all part of the preventative care. I worked as a proud registered nurse in rural areas, acute care, surgical nursing, community nursing, palliative care, and most recently up until November 15 on a COVID unit. Over the last 16 years, working with 2 different health authorities and in various healthcare settings, along with many of my colleagues, I have personally witnessed and lived through the massive healthcare cuts, austerity, and privatization from the BC Liberal government. My LPN colleagues and many hospital support staff in healthcare struggled financially due to the massive 10% wage rollbacks under the BC Liberals government. I have witnessed my coworkers breaking down in tears and crumbling when they were constantly understaffed and overworked. I was also one of them. And that is before any mention of the violence nurses face in healthcare. Therefore, I appreciate our government's every sincere effort that has been made during the last 3.5 years. One can blame, point fingers, find faults, nod heads, wave their hands, or criticize the efforts, or even try to take credit for some of the things they want. But the reality is that healthcare workers can tell firsthand when cuts are implemented and when more services are being added, because it makes enormous difference in their working conditions for their physical and mental health. And most importantly, the quality of patient and seniors care. We still need many more nurses to fill the gaps that were left until 2017. The member's remarks were concerning to me and to many others, especially coming from our healthcare critic. I would like to request that our government continue with its progress dealing with this chronic staffing shortage. I thank our government for hiring many more nurses in mental health and substance use areas, as this has been a great resource to refer patients to highly dedicated teams. I am grateful for our government for giving us an MRI and urgent care center in Vernon-Monashee. Prior to this, we had to send patients to Kelowna, and they had to wait for too long in order to get their MRI done. We also had to book patient transfer teams, and most of the times nurse had to go with the patients. Then we had to backfill that nurse, mostly on overtime. So imagine the amount of money we had to spend on patient transportation, having extra staff or leaving existing staff working short when we were not able to backfill that shift. We were spending way too much money by doing so, and the patients were suffering from long wait times, delayed diagnosis, and treatment. This also had a major impact on the patient care in Vernon due to short staffing when we were unable to backfill the staff. Having MRIs widely available is a proactive approach. My mom had her MRI done recently, and she only had to wait for 8 days, and her appointment was at 7 p.m. My father-in-law had his knee replacement done in October during COVID, and he didn't have to wait for long. And he received exceptional care, which he's so grateful for. Improvements and investments in services like healthcare, mental health, and seniors care are some of the best investments any government can make. Investments to deliver better care for seniors, stability and safety for long-term care workers will hugely benefit my riding. We have many seniors who have worked hard all their lives, and it is our turn now to give them the support and quality care they need and deserve. We do have much more to do, and I am confident that having a dedicated group of people in this house will focus on working together, as all of us are here to serve our constituents and make lives better. Mr. Speaker,